morning. This is your Dr. Vinay, surgical gastroenterologist from Hyderabad. Just wanted to tell you about this coronavirus. Let me make it very clear to you. There have been far more dangerous viruses in the past. In 2002-3, we had something called the Ebola virus, which mostly was concentrated in Africa. The death rate from that was as high as 40%, which essentially meant that of every 1 lakh people, 40,000 people had died. After that, in 2009, we had the SARS virus. The death rate from the SARS virus was 10%, which meant that of 1 lakh, 10,000 people died. In comparison to that, deaths from the present coronavirus is 3%, meaning of 1 lakh, 3,000 people are dying. The people affected all over the world is much larger than the Ebola virus and the SARS virus. But the death rate is comparatively very low. At the same time, it is unfortunate that those 3% deaths are occurring. The deaths are mostly in elderly people above 70, the weak people, those who have comorbid conditions. Comorbid conditions means those who have diabetes or hypertension or similar such sort of thing, or very small children. This sort of thing did not happen with Ebola or the SARS virus. The SARS virus and the Ebola virus killed people irrespective of age, irrespective of their immunity levels, irrespective of whether they had diabetes or not, whether they had hypertension or not. Then why are we being asked to take so many precautions? Precautions are basically more than us. It is that let us not carry the infection home to our elders, to our children. Because most of the time, those who go about outside are the healthy and the strong people. Now, when they are healthy and strong, if 100 people are getting affected, 85% of people, that means out of 1 lakh, 85,000 of people are either not knowing the symptoms, the virus is coming, infecting them and going off without they themselves knowing that they had the viral infection, or they are having mild symptoms like cough, sneezing, mild fever and things like that. Of the rest of the 15%, 12% are getting more serious infections like pneumonia, lungs getting more seriously affected and things like that. 3% of them are dying. Basically, this social distancing is so that it doesn't come on to us and we don't carry it home to affect our elders and the children. After all, they are the ones who took care of us when we were children. Now it is our responsibility to take care of them. So please continue to maintain social distancing because we are entering into a critical phase. All these days, people from outside the country were coming and infecting people over here. Now we have entered into a phase where inside the country one person is infecting the second person. So this is a very critical and crucial phase. If we sit at home, we will not get the infection, we will not infect someone else. And as I said in my previous videos, we do not know about the properties of these viruses. There is something called an RNA on the virus, which has most of the properties of the virus. This RNA has not been studied as yet. No research has taken place. So please don't believe if someone is telling you that the virus is weaker in India, unlike in the West. No, we don't know. It may be weak, it may be strong, but we do not have a research to say that it is weaker in India. Or if someone is saying that it stays for 72 hours on the cell phone. We have no idea how much it stays on any surface. All we know is that on a surface it does not get food to eat, so it dies soon. Inside our body it gets a lot of food to eat, so it starts multiplying. That takes 2 to 8 days. After that, if we are strong, the virus dies, or if we are weak, then the virus affects us. So cell phone these days in isolation is a good friend to us. All these days we were saying don't use the cell phone much, but now it is a good friend to us. So don't get scared that will it be there for 72 hours on the cell phone. No, we don't know. It may die in a couple of hours. We have no idea. I remember a lot of this scare is from what we have also read in newspapers. I remember the first case when it happened in Hyderabad for someone in Mahindra Hills. The banner headline of a newspaper was "Virus in your city" or "Corona in your city." Jet black letters, huge letters, and big banner headline. Now, that is what is, I think, scaring most of the people. I don't think you should be scared. Just keep yourself away from another person. Please treat every person you meet as a person with infection and take all the precautions necessary as you would take if you meet an infection person. The infection does not come to you. You can be at home, feel free, enjoy your life with your elders. Thank you so much.